everyone. I'm Madeline Davis, a senior editor at The Examination, which is a new non-profit newsroom that investigates health threats from corporate activity. So we look at tobacco, industrialized food, oil and gas, and the drug industry. And I'm absolutely delighted to welcome Professor Keshia Pollack Porter, the Bloomberg Centennial Chair at the Department of Health Policy and Management, Johns Hopkins Bloomberg School of Public Health. As you've seen in the video, Professor Keshia Pollack Porter is going to share details on the Judicial Health Notes project for the very first time today. It's just launched, it's hot off the press, as us journalists like to say. So Professor Pollack Porter, could you tell us what problem you're trying to fix here?
Yeah, first of all, thanks, Madeline. We are thrilled to release the Judicial Health Notes today. And the problem we are trying to solve is that every single day, decisions are made in sectors outside of health, such as transportation, energy, housing, and health impacts aren't always at the forefront. So my colleague Stefanie Carignan and I and some other colleagues created a tool a few years ago called the Legislative Health Note to focus on proposed bills. And we saw an opportunity to also highlight court decisions. And so that's the problem we're trying to solve.
And could you talk me through one key example of a judicial health note?
Yeah, so today we released 3 health notes that we've been working on for the last several months, and one of them relates to a case that some of you may have heard about, and it's called Grants Pass v. Johnson. And so this is the case that the Supreme Court, the US Supreme Court this summer, basically ruled that it is permissible to remove homeless individuals from encampments, even when there's no place for them to go. And so basically what we did is we saw that the discourse around this case didn't involve public health or equity in a way that we thought needed to happen. So we conducted an analysis, we pulled together data, and we pulled together some literature, and we showed the impacts for individuals who are forcefully moved. We saw how their access to treatment and healthcare could be disrupted. We also saw that there were challenges for individuals where actually instead of reducing or making it safer, it actually increased interactions with law enforcement. And we saw impacts on people actually having fines or more interactions with police that could actually make it harder to get homes in the future or secure a job.
Mm-hmm. And what impact are you hoping these judicial health notes will have?
We hope that we will be able to highlight the potential health impacts, particularly when health is not always at the table. And I want to acknowledge all of my colleagues, including myself, who oftentimes submit amicus briefs to highlight the potential health impacts and try to influence a judge's decision. But what we want to do is say, well, after a decision is made by a judge and somebody has to do something to comply with the law, during implementation, how do we think about health and equity? And that's our focus. So what I hope and my vision is that people are calling us, that they want technical assistance, and that they're looking at how to use this tool to bring health to the table when health is not being focused on.
And did it shock you that judges weren't taking public health considerations into these decisions?
Not at all, not at all. And I think everybody's laughing here. I mean, I'm sure you're not surprised as well. You know, so much of this work is part of what we've been moving forward, which is called Health in All Policies, and really thinking through how can we be intentional about bringing health to the table in a number of decisions. And so we weren't surprised, and that's why we created this tool, and we believe there's great potential to highlight how we can bring health to the table when health is not being discussed in a way that we think is grounded in evidence and doesn't take into account all of the things we know about how to improve health and to reduce harms.
And I found this incredibly inspiring when I learned about it. Could you talk me through some other examples of judicial health notes? I think the audience would be really interested in hearing about them.
Yeah, we looked at another case that relates to the environmental challenges focus area of the Bloomberg American Health Initiative. And this one relates to a case out in Utah where basically there's a big lake that's drying up. And you might think, well, of course there are health impacts there, but this particular case, when you looked at the court decision, and it's actually the courts are in the process, the judges in the process of deciding this decision, we wanted to highlight all of the ways that the drying of this lake could impact health. And so we pulled together the evidence, and we saw impacts on respiratory illnesses. We saw equity impacts in terms of the people who live close to this area. We saw potential for toxins to be carried from the dry beds in the land, and this really was important. And we hope that individuals and advocates and other organizations will take our findings and help to really think through how we can reverse some of these impacts, how we have the evidence to say, let's look and see how we can actually slow down the degradation of this water source that's so critical for Utah.
Mm-hmm. And we've got 30 seconds left. I think we've got a QR code to bring up. Professor Pollack Porter, what's the vision for the project going forward?
Well, first of all, take out your phones, scan the QR code, and we hope, my colleague Stefanie and I and our whole team at the Johns Hopkins Bloomberg School of Public Health, hope people reach out, contact us to learn more about the Judicial Health Notes. Check out the ones that we have posted online, and please contact us and promote health and all policies through this new tool.
Thank you so much. So inspiring and exciting.
Thank you. Thank you so much. Thank you.
Please welcome Dr. Marian Nessel, Paulette Goddard Professor of Nutrition, Food